Welcome to Nursing with Professor B. In today's video, I will be giving you an update on COVID-19, the death toll thus far, how many people infected, etc. But first, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. So I am still working in person. A lot of doctors' offices have shut down and they're doing telemedicine. That is not the case with me. I'm still at the front lines with this. And definitely exposed to it. So I urge you, there's a lot of controversy out there, a lot of skepticism. This is very real. My boyfriend is also a nurse directly taking care of COVID patients in the ICU. And he has seen these COVID patients firsthand. He's had to prone them when they are on vents. So this is very real. The hospitals are not empty. And people are getting very, very sick from it. All right, so I urge you to take this seriously. This is not a game. It's just, as healthcare providers, we're out there risking our lives for you. And yet I will be driving by. And I understand that, these are probably young kids. They don't know any better. They're mentally immature still. But see a group of kids congregating, large group, together, not 6 feet apart, more than 10, talking, have a grand old time, not realizing that the actions of them affect the actions of others. It does affect children. COVID-19 does affect children, but usually doesn't affect them as seriously. So what could be happening is that these children could potentially be vectors, right? They get infected themselves. They're asymptomatic, they're carriers, they go on, they take it home, they give it to mommy, daddy, grandma, grandpa, and then grandma, grandpa ends up in the ICU fighting for their life. So we all have a responsibility right now, and I urge you to be responsible. So how are we doing right now? This is the COVID-19 dashboard provided by the Johns Hopkins University. Data is taken by the World Health Organization, the Centers for Disease Control and Prevention, and a few other facilities that gather data. So this is a reputable site. Thus far in the United States, we have 530,830 confirmed cases of COVID-19. Total deaths in the United States have been 20,646. Now, the experts estimate that we will lose this year from COVID-19 around or between 80,000, which is the most moderate estimate, to 200,000 people. As you can see, our curve is not flattening at all. We are going straight up. So if we continue to not isolate and not follow guidelines, this will continue to rise. So it's very important to follow guidelines, protect yourselves. You don't know if you are, everyone should treat themselves as if they have it and you don't want to give it to your loved ones, okay? This is a hard time. I'm a hugger. I love physical touch. I love affection, and having to not be close to people is very difficult for me because that's my love language. But that is what we have to do right now so that we can get the curve. We really want to, this is what we mean by flatten the curve. We don't want this to keep climbing up. We want this to curve down and see a decline in it. It's not just the very old that are at risk. There have been many doctors, many physicians, especially in Italy, that have lost their lives, that have been young, healthy, men in their 30s, in their 40s. And in fact, here I have several, I teach nursing students. So I have several ex-students that have shared with me that many of their patients are in their 40s, 44, 46, and they're in the ICU right now on vents, fighting for their lives. This is not to scare you. This is not to spread panic, but it's just to tell you this is very real. This is not some conspiracy theory that the government is trying to overtake us and keep us cooped up in our house and they're stripping away our freedoms. They're doing this to protect us. They're doing this because we at times are petulant little children and we cannot delay instant gratification for long-term effects. That's just the way it is. So the government has to step in and tell us what to do, because sometimes we can't be responsible adults and do it ourselves. Thank you so much for watching, and stay safe.